Tuesday morning in that sort of 7:20-ish time slot, and joining us live as he does almost every week is Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Good to see you this morning, Dr. Bogoch. Of course, you know, we've talked a lot about measles in recent weeks. I mean, a lot. And that's because there have been a lot of cases in Ontario specifically. And of course, the public health data shows that the spike we're seeing and that you told us wasn't going to slow down. A lot of this, though, really goes back to people's vaccination status, doesn't it?
It absolutely does. And when you look at the data for Ontario and basically anywhere else in the world, you see that this is largely an infection in non-immune people. In Canada, if you were born before 1970, it's very, very likely that you had this infection and recovered from it and are given, immunity. But those born after 1970 should be vaccinated, and that's when routine vaccine programs were initiated. And we really do see the overwhelming majority of cases of measles in unvaccinated individuals or in individuals that have received only one, not two, of the doses of vaccines.
Absolutely. Okay, I know we got some boards we're going to get to sort of showing and reflecting the data you're talking about there, Dr. Bogoch. But also, we should point out measles was considered eradicated not that long ago here, and that can be attributed to the vaccine. I want to bring up another chart, not this one, but we'll get to it in a second here, which shows our viewers this morning. And while it may seem self-explanatory, it's the next chart here, folks. It really shows us kind of the impact of vaccines on measles and the illness here.
Right. The one that we're looking at right now is just looking at okay, let's go talk about this one. This one is sort of what we talked about a second ago. Each bar represents an age group. So you can see the bar on the far left is those under 1. The bar at the very far left are those over the age of 40. So those are the age cohorts. And that sort of pinky orangey color in the middle are non-immunized individuals. So you can see the vast majority of cases in Ontario, this is the Ontario outbreak, are in non-immunized individuals at all age groups. And yes, of course, is the vaccine 100% perfect 100% of the time? No, nothing is. And that's why you see some little bits of blue in there. Those are people who have received 2 doses of the vaccine. That is the vast, vast minority of individuals with measles vaccines. This just shows you that this is truly an infection that is impacting those who are not immune to this virus. And this one that we showed briefly, that just shows the current epidemic. So those are the number of cases over time, and you can see the various the timeline on the bottom and the confirmed and probable cases. So maybe it's slowing down a little bit. That would be wonderful news. This is an impressive chart here. You can see how on the far left, there's lots and lots of measles cases identified. And then in 1963, when the measles vaccine came out, we saw a tremendous drop in cases. Then you see a little bit farther along, routine childhood immunizations. 1 dose of the MMR vaccine was given, and you can see a further drop in cases. And then it's almost a flat line in 1996 when routine childhood immunizations were 2 doses of the MMR vaccine, with a few little bumps here and there.
Yeah.
But in general, this vaccine essentially eliminated the virus from the country and is so effective. This is Canadian data. It is so effective. And when we take our foot off the gas pedal and we see slipping vaccine rates, especially in pockets and communities, those are vulnerable to infection. And right now we're watching this virus exploit those pockets because it's so transmissible. It gets in there, and unfortunately, people get infected with this.
Okay, so I appreciate you walking us through those charts, Dr. Bogoch. Let's also talk about this, because this ties into vaccinations as well. Dr. Kieran Moore, a name that I haven't said for a couple of years, I feel like now, Ontario's Chief Medical Officer of Health, that people have forgotten. He's now adjusting the recommended timelines of when infants should be getting the measles vaccine because of the seriousness here.
Right. So normally, the first dose of the vaccine is given at 1 year. And the second dose of the vaccine is given, at around 18 months or sometime before a child enters school. But in the hard-hit areas in Ontario, in southern Ontario, there's a few areas where the recommendation is that the first dose of the vaccine can be given at 6 months to 1 year. And I think that's important because children, the youngest, are the most vulnerable to this. We know that those under 1 year aren't immune to this. They don't have, with the prior recommendations, they're not eligible for vaccinations. And this provides a level of protection to a very vulnerable group. And again, that's not for all of Ontario. Those are for the regions in southern Ontario that are impacted by this. And of course, like anything else, public health changes as data changes. So I wouldn't be surprised if Dr. Moore updates this at some point as we see this progress, either as it fizzles out or, unfortunately, if it gets worse. But that's the current recommendation now. So some people in those hard-hit areas where we see most of those cases can vaccinate at 6 months to 1 year rather than just at 1 year.
All right, appreciate you walking us through all that data this morning. Dr. Isaac Bogoch, as always, appreciate the time and insight. Talk to you soon.
My pleasure. Thank you.